GOLD participants from around the world. I'm Fleur Bickford, Program Director and MC for GOLD Learning. I'm chatting today with Dr. Theresa Nesbitt about her upcoming closing keynote presentation for GOLD Perinatal 2016. Her presentation is titled Breastfeeding, Instinct or Skill. So Theresa, thank you so much for being with us today.
I'm excited.
Well, we are excited to have you with us, and I'm really looking forward to your presentation. But before we talk about the presentation, perhaps you can tell our delegates a little bit about yourself and how your interest in breastfeeding began.
Well, I'm an RN and a physician. I actually have a lot of other initials after my name, but these days I'm very much more interested in women's wellness. So I sort of moved away from delivering babies to a delivering advice kind of sphere that I operate in right now. I've always been very interested in breastfeeding. I guess became interested when I started to breastfeed my own son, and I didn't really know very many people. I had very sort of poor support. But it was something that I really wanted to do, especially after I had a very difficult birth and delivery. I wanted to have some of that normalcy return to it. I worked in a zoo a lot when I was younger. I've always been very interested in animals, and there's been a big overlap with my interest in animal physiology and evolutionary biology. So what happened later on is that I started to do a lot of research into brain health and development. That's where my nutrition comes in. So I started to look at breast milk as brain juice. That's sort of one of my favorite talks. And everything started to kind of come together. Now, I was very interested in milk at first, but these days I think I'm a lot more interested in actually helping moms be able to breastfeed, because I see so many of them. I saw it before in my practice and I see it now, is that so many women, they really, they plan to breastfeed, or they think they want to breastfeed, or they know that they want to breastfeed, but they hit some stumbling blocks very early on. So that's where my main interest lies these days, is really helping new mothers initiate breastfeeding by simplifying the process.
Okay, thank you for that. I love how, your interest developed. I think similar to a lot of us, from your own personal experiences, but also your experience with working with animals. I love that.
My favorite animal story is, I was actually just relaying, is I do some dog breeding right now. So I am really interested in this rare breed of dog, and it's very distressing to me how much attention that I see dog breeders will pay to the composition of the milk and making sure that the puppies are all nursed appropriately and that they're observed during the first 48 hours after they're born. And we don't do those things for new human moms. So I guess that's my new quest with that.
Yeah, that's very true, unfortunately. And yeah, it's interesting for sure how often we do pay a lot more attention to that sort of thing with animals than we do for ourselves. So interesting point. So in your abstract, one thing I wanted to ask you about is you talk about natural breastfeeding. So I'm hoping you can tell our delegates a little bit more about what you mean by that term, natural breastfeeding.
Well, natural breastfeeding really comes about. We looked at Nancy Moorbacher, who I'm sure everyone who's listening today is familiar with. I'm so pleased to be able to work with her so closely for the past several years. We started meeting and tried to find common ground, which we had a lot of common ground, and brought two different backgrounds. And we really focused in on this period of time for new mothers and new babies. So natural breastfeeding is very much oriented towards the differing needs of a newborn, like for the first month to 6 weeks, that first 40 days when milk production is amping up, and a time where we like to see mothers doing a little bit more of the natural things that help promote the appropriate hormones and interactive behavior between mom and baby that very naturally occur. Like for me, a lot of times when I get questions about how do you see these solutions to the problems, I say, well, a lot of times the baby's the solution to the problem. If moms would just allow the babies to sort of hijack their brain and their hormones, then a lot of these things get started. So natural is sort of stripping away the technology and the intervention and a lot of the over-instruction and overthinking, and really paring down what is a new mother and a new baby need to just get started. So physiologically, I come from a background where I used to work a lot with movement and athletes. I actually used to say my MD stood for the movement doctor, and I had a website with that. And so physiologically, I'm really interested in how we learn how to be able to move and the motor programs. That's a lot of what this talk will be about, is that the maturation of the nervous system is that humans are born in this very immature state. So in that first month of life, babies they're helpless, but they're not completely helpless, and they actually have a lot to, if we can just put them in the right position, in the right context, to be able to participate more fully as a partner in breastfeeding. One of the problems that we see, and this is why we say it's very natural, what would have been natural is for mothers to just have observed breastfeeding when they were younger. That isn't really happening. So now we're teaching breastfeeding, and a lot of that gets in the way, and we don't really acknowledge that mothers really have learned a lot of things that they haven't been taught. So there's a lot of pictures in their mind and preconceived notions that you can't just act as if they aren't there. So there's a little bit of an unlearning process, and if you strip away a lot of the instructions, we found that the three biggest problems that we see that 92% of new moms have in the first 2 weeks of life that we're planning to exclusively breastfeed, so they really are committed, is that they are having difficulties latching, they're having nipple pain and trauma. They expected it, but maybe not as bad as it is. It's worse than they expected. And the concern about whether they're making enough milk. And what we find is using these natural breastfeeding techniques and simplifying the language and using video to help them observe, much as they would have in real life, to have a learning process that would be more similar to the natural learning process, that we find that moms are really able to make a few small adjustments and use this easier tummy down position. It is sort of like laid back breastfeeding position, but natural breastfeeding's more broad than that. It's a makeover, a little bit different information, and a focus on how to help moms learn how to do it. So it's kind of a little bit more directly to mothers. Does that make sense?
Yes, absolutely. That's fascinating. And I think it's, really interesting to think about how I think sometimes the logical brain does kind of get in the way of breastfeeding. What you're saying about sort of preconceived ideas and things that we've learned over the years and expectations.
It's natural for humans to learn. I mean, that's what makes us very human. So we have to always understand that moms have actually learned a lot. They might not be aware of, a lot of that might be unconscious, or they don't know, but those images or those expectations and those observations of a lot of ways that they feed babies, they're going to be a lot from bottle feeding and a lot from breastfeeding older babies who have a lot more motor ability. So that's kind of where we wanted to go for this, is really pinpoint naturally is all this, are we hardwired to breastfeed or things, or what takes place is, well, there are things that get in the way that are easy to remove, and the baby can help if you put them in the right position. We say it's like the turtle. Like if you take the turtle that wants to go across the street, you flip them over onto their feet, they can walk. You don't need to pick them up and carry them. So that's one of the ways that we explain this, is that the babies can do so much better if you just flip them over in these early few weeks. They can use their body a lot more effectively. You don't have to hold them and guide them through each step, as long as you put them in the right position.
Okay, thank you so much for that, Theresa. It sounds fascinating and really looking forward to hearing more about it. As we finish up here, perhaps you can just tell us a little bit about what you hope delegates will be able to take away from your presentation back to their own practices.
Well, that's probably the most exciting part of this is, first of all, is we actually, Nancy and I did a lot of videotaping that we have started to make available. We have a 38-minute quick start video of how natural breastfeeding works. But what we're finding as we're starting to use it with the professionals, especially dealing with moms right around the early postpartum or even in the prenatal period where they can practice skills with a doll or a bag of rice and learn to set up their environment. Just spending a few minutes doing this is what we're really seeing is what is perceived as an insurmountable problem getting in the way of breastfeeding is very, very easy to fix in a very short period of time. So I'm hoping that everyone goes away with a lot of Monday morning sort of points of like, oh my gosh, I just did this, or I showed her the video, and we were able to fix this situation in really, really short amount of time. And even in a large variety of environments, like it works really well. You can actually just use a regular old chair and have people scoot forward and things. So I'm hoping that they come away with an understanding of what abilities, instincts, reflexes, a lot of those neurologic words that mean a lot of things to people, is that we strip those down, we start at the beginning, we help people understand, we help all the delegates understand where this came from, and then the application flows very, very quickly and practically from that background.
Okay, thank you so much, Theresa. I know I am really looking forward to your presentation. For our delegates who are listening, you'll be able to hear more from Dr. Theresa Nesbitt during her live keynote presentation, and that is taking place on Wednesday, October 6th. She will be presenting live twice that day at 1700 and 2200 UTC. So please make sure to visit our website at goldperinatal.com for more information and to reserve your seat for our keynote presentation. Thanks everyone for joining, and goodbye for now.